Hello everyone, Assalamu alaikum. I am Dr. Abdur Rahman Rana, Assistant Professor, Department of Pharmacology and Therapeutics at the Akij Medical College, Boyra, Khulna. My today's topic is source of drug, or where do the drugs comes from. Firstly, what are the source of drug? There are mainly two types of source of drug. This is natural source and synthetic source. In a natural source, it contains plant source, animal source, human source, microbe source, and mineral source. And second is synthetic source or laboratory source. Nowadays most of the drugs are produced in the laboratory. This is the synthetic source. Then what are the in the natural source? This is the plant source, human source, animal source, microbe source, and mineral source. Firstly, what is plant source? In the plant source, different components of drug is origin from the different parts of plant. We can obtain the drug from the leaves of the specific plant, seeds of the specific plant, barks of the specific plant, root of the specific plant, flower of the specific plant, and fruits of the specific plant. From the leaves of the specific plant, we can obtain the atropine, caffeine, cocaine, digoxin, and from the seeds of the specific plant, we can obtain castor oil, morphine, strychnine. From the bark of the specific plant, we can obtain the quinidine and cinnamon alkaloids. From the roots of the specific plant, we can obtain atropine, reserpine. From the flower of the specific plant, we can obtain the rose water from the rose, vinblastine from the vinca rosea, and lastly from the fruits of the specific plant, we can obtain from the coolabarbin seeds, we can obtain physostigmine. Then the plant source, we can obtain the various active constituents. In the active constituents, physiochemically we can obtain alkaloids, glycosides, oils, gums and mucilase, carbohydrate, tannins, and antibiotics. First four, this is alkaloids, glycosides, gums and mucilase and oils are very important. Then what is alkaloids? Alkaloids means alkali-like substance. This is alkali-like basic nitrogenous compound which is plant in origin, produce salt when combined with acid, and physiologically this is active in plant and animal. Alkaloids are bitter in taste, insoluble in water, but their salt are freely soluble in water. Alkaloids are the crystalline compound and its name is end with INE. This is morphine, atropine, quinine, reserpine. Morphine is obtained from the Papaver somniferum, atropine is obtained from the Atropa belladonna plant, quinine is obtained from the cinchona alkaloids plant, and reserpine is obtained from the Rauwolfia serpentina plant. Then what is glycoside? Glycoside are the organic compound which is formed from the condensation of sugar. This is monosaccharide with the hydroxyl group that contain a second compound which is aglycone that may or may not be the monosaccharide. Then what are the characteristics of glycoside? It is colorless and crystalline compound. They split into sugar and non-sugar part. That reaction with acid, it breaks after the reaction. Its nomenclature end in IN. This is exoxin, digitoxin. It is chemically bile acid, steroid hormone compound. It is pharmacological activity of the glycoside resides in the aglycone part. When it combined with sugar, it modifies the lipid water partition coefficient. It is modified the potency and pharmacokinetic properties of the drug. In the aglycone can be separated from the sugar when we adding the acid or enzyme. Now what is oil? Oil is the immiscible with water and dissolved readily with the solvent like ether, chloroform and alcohol. There are mainly three types of oil in the medicinal value. The three types are the fixed oil, volatile oil and mineral oil. What is fixed oil? Fixed oil are esters of fatty acid and glycerol. Most of them are edible oil. It is the fixed oil are the non-volatile compound. It is lighter than water. Mostly it is insoluble in water but soluble in chloroform and ether. The example of the fixed oil is the mustard oil, coconut oil, olive oil, castor oil. The castor oil is the catalytic compound. It irritates the gastric mucosa and promotes evacuation of the bowel. Then what is volatile oil? Volatile oil is called the essential oil. It is also called the flavoring oil. It evaporates when exposed to air at room temperature. It is odorous compound. It obtained from the various parts of the plant. The example of the volatile oils are peppermint oil and spearmint oil is the flavoring agent, and clove oil or wintergreen oil, and clove oil is used for the relief of toothache, and wintergreen oil is used for the relief of joint pain. Then what is mineral oil? Mineral oil is the hydrocarbon by chemical nature and it obtained from the petroleum. Example of the mineral oil is liquid paraffin. Liquid paraffin is used as an laxative or lubricating agent. Then what is gums and mucilage? Gums and mucilage are the secretory product of plant. Gums are readily dissolved in water, but mucilage are not really dissolved in water. It forms in the silimas. Gums is the pathological compound or product of the plant, and mucilage is the physiological product of the plant. Mucilage is used for the suspending agent or emulsifying agent for the oil and resin, and an adhesive agent. Suspending agent for the insoluble of the powder in the mixer. And gums are used for the emulsifying agent. Animal source. Animal source means the drug is obtained from the animal. This is also called a biological drug because it is obtained from the living source. The example of the animal source are insulin, anti-tetanus toxin, anti-diphtheria toxin, gonadotropin, pepsin, heparin, immunoglobulin. Insulin is obtained from the pancreas of oxen and pigs. The drug is obtained from the oxen is called bovine insulin, and pigs is called porcine insulin. Anti-tetanus and anti-diphtheria toxin obtained from the horse globulin. Gonadotropin is obtained from the serum of pregnant mare, and pepsin is obtained from the stomach of oxen and pigs, and heparin is obtained from the intestinal mucus of the porcine or bovine lung. And lastly, immunoglobulin. Immunoglobulin is obtained from the pooling of the plasma of the selected donor with the high level of specific antibody. Example as tetanus immunoglobulin. Then what are the criteria of the animal source? Usually it is protein and polypeptide in nature. Due to protein and polypeptide in nature, it should not be given through the oral route, it must be given through the parenteral route. Due to protein and polypeptide in nature, if we give it through the oral route, it is metabolized in the stomach and GIT by the proteolytic enzyme. And due to protein and polypeptide in nature, which have more antigenicity that produce the hypersensitivity reaction. Due to protein and polypeptide in nature, it must be kept in 4 degrees Celsius temperature, otherwise denaturation of the protein molecules occurs. Those are the criteria of the animal sources. Then human source. The human source, those means the drug is obtained from the human. The example of the human source are immunoglobulin, human menopausal, this is post-menopausal gonadotropin, human chorionic gonadotropin, and growth hormone. Immunoglobulin is obtained from the blood, and human post-menopausal gonadotropin is obtained from the urine of the post-menopausal woman that contains mixture of follicular stimulating hormone and luteinizing hormone. Human chorionic gonadotropin is produced by the placenta, and this is purified from the pregnant woman. And lastly, the human source is growth hormone. It is obtained from the anterior pituitary gland. Then microbes source. Microbe source are mainly the source of antibiotic and enzymes. Various types of drugs is obtained from the microbes. That as for example, from the actinomycetes we obtain actinomycin, chloramphenicol, erythromycin, kanamycin, neomycin, gentamicin, streptomycin, tetracyclines, etc. From the aspergillate group of fungi we obtain penicillin, graciofulvin, cephalosporin, etc. Those are the examples of the microbes. Then minerals. The mineral source we can obtain various elementary substances and their salts we used for various purpose. As for example, we can use as an elementary substance iron, gold, iodine, sulfur, mercury, colamel, etc. Iron is used for the treatment of iron deficiency anemia. Gold is used for the arthritis. iodine is used for the thyrotoxicosis, sulfur is used for the skin disease, mercury is used for the congestive cardiac failure, this is heart failure, and their salts such as antimony salt is used for the kala-jar, bismuth salt is used for the peptic ulcer disease, magnesium sulfate is used for the relief of constipation and control of the eclamptic seizure, and magnesium and aluminium salt is used as an antacid preparation for dyspepsia. Then lastly, synthetic source or laboratory source. Nowadays most of the drug is obtained through the synthetically in the laboratory source. It is totally or partially synthesized. Structural activity relationship means when we change the structure of the parent drug side chain or the parent molecule, we obtain the new drug. It produces the more desired action and reduce the adverse effect of the drug and increase the potency of the drug action. In the Viva, one question is asked invariably: which one is better source of drug action? Is natural source or synthetic source? The answer is the synthetic source is better than the natural source, because the advantages of the synthetic source are: it is high quality drug, it is pure drug, and it is the safe drug, it is the less expensive drug, a large scale of production within a short time can occur, and most effective than the natural drugs. That's why synthetic source of drug is more better than the natural drug. Thank you all for watching my today's lecture. Assalamu alaikum.